This demo will focus on two main software outputs from Work Package 4. The first is the construction of a data mining tool to visualize and be able to look at the association rules that have been generated from data mining. And the second is the development of a clinical evidence web-based service to allow us to access clinical evidence contained in our ontology. So to begin with, let's look at the data mining tool. This is a web-based tool, so to begin with, let's log into the tool through our browser. And we get a screen where we will select the rule viewer to look at the main screen that gives us the association rules that we've generated through our data mining algorithms. So in the center here we can see the characteristics associated with our association rules. So at the moment we have 32,676 rules contained on the system. So we want to filter to identify clinically useful association rules that we feel we should be able to select and transfer to our clinical evidence ontology. So we get a list of our filters here at the top of the screen. So we can filter based on the antecedents of the rule. So these are either the patient-reported reasons for encounter or the clinician-observed ANOMS, which are diagnostic cues that were recorded as part of the consultation. We can also then filter based on the demographic features of either sex or age group that were included in the rule. And finally, we can filter based on the consecutive, which is the diagnosis or condition that's indicated by the ANOMS and demographic characteristics. So to begin with, let's consider one of our patient safety use cases in Transform, and let's filter for a patient presenting with abdominal pain. So the ICPC2 code for abdominal pain is D06, so let's select that and filter based on that characteristic. So this reduces the number of rules down to 818, and you can see in the antecedents here of the rule, they all contain D06. So we might want to filter this further. So maybe we want to look at a particular demographic. So in this case, we look at females only, and then select filter again. So now we have 222 rules, and you can see in the antecedents we have female and also abdominal pain in all of the rules that we've selected. We can see here that the consecutive means that this combination of antecedents is associated with many different conditions that we may be interested in. So let's filter based on a particular condition that we want to investigate and identify suitable clinical evidence to transfer. So let's select U71, which is the ICPC2 code for urinary tract infection, and filter based on that. So now we get 53 rules that correspond to this selection of filters. And you can see that in the provenance column we have rules that are associated with different countries. So we have rules associated with the Netherlands, and we've also rules associated with data that we obtained from Malta. We may also want to filter based on the scenario. What the scenario label allows us to do is to rerun our association rules at any time and apply a label to that running of the rules so that we can retain multiple copies of our association rules while maybe changing some of the quality measures or calculations to test them out. So in this case we have a number of scenarios here, and we're going to filter based on the most recent set of rules that were generated, which was done on the 13th of June, and we'll filter based on that. So now we have 35 rules for just that scenario, and we're going to filter and choose rules just for the Netherlands. So this reduces our rule list down to 20 rules that we might be interested in. So now what we might want to do is to filter based on some of the quality measures that we've calculated. The quality measures indicate the strength of the association of the antecedents to our consecutive. So we're interested maybe in cases with strong associations. So let's filter in this case based on a support of greater than or equal to 5 cases. So in this case this will allow us to filter and retrieve rules where the number of patient cases for the rule is 5 or more. So now we have just 15 rules left. So now we might want to sort these rules to look at them in descending order of confidence. So if I sort on the column here in descending order, we can see our list of rules in confidence, highest confidence first, descending. So the higher the confidence level, the more strongly the association is between the antecedents and the consecutive in question. So let's select the first rule here in our list at the top, and let's collapse the table to see a textual description of what that rule means. So in this case, we have an association between a patient presenting with abdominal pain and dysuria with urinary tract infection where the sex is female. So this seems like a sensible clinical rule to deploy to the ontology, so let's select to deploy that particular rule. We have other rules here which include other demographic characteristics. For example, in this case we have one between abdominal pain, dysuria, sex female for a particular age group associated with urinary tract infection, but we're going to focus just on rules with no age group restriction, just for females. So we have another rule here which associates urinary frequency and abdominal pain as patient reason for encounters for females with urinary tract infection, and we might wish to deploy this to our evidence ontology. So let's deploy one other rule, and in this case we have an association here between abdominal pain and a back symptom complaint for females with urinary tract infection, and we'll select to deploy this rule as well. So now that we've selected the rules that we wish to deploy to the clinical evidence ontology, we can go to our rule sender screen. So we'll see here the list of rules that we selected to transfer to the clinical evidence ontology. So we have our 3 rules selected here. So when I click on the send button here, this generates a XML file with the rules encoded that the evidence service can use and process to update and input the various quantifications and support, confidence, likelihood ratios and so forth for each rule, along with the contextual information and the rule antecedents and consecutives. So in this case we have our 3 rules here represented in XML format. So let's update this rule file into our clinical evidence ontology. So to access our clinical evidence ontology, we can access it through our web service. So if we go to the URL for the web service, we can go to the update interface, and we can select the file UTI rules to update and process into the ontology. So let's select and run that. So we get back a message indicating that the clinical evidence ontology has now updated the file and processed it successfully. So what this has done is it's iteratively gone through each of the XML rules, looked to see if the antecedents, such as the reason for encounter or diagnostic cues, exist in the ontology. If they don't, it creates them, and it also creates the correct ontological associations and the quantifications that we've calculated in the data mining tool to update them into the ontology. So the ontology itself is stored in a Sesame repository, but we want to access this through an evidence web-based service. So let's see access to the ontology through the evidence service. So we can do this through the query interface. So it's a REST-based web service. So every concept in the ontology has a web address that we can access to view them. So to begin with, let's look at the reasons for encounter that are encoded in the ontology. So by going to our REST-based service, we can query the reasons for encounter, and we get back abdominal pain, localized, back symptom complaint, chest pain and so forth as being reasons for encounter that we might want to query in our ontology. We now might want to look at what differential diagnoses that we might want to consider based on a particular reason for encounter. So in this case, let's look at abdominal pain. So when we connect to that, we now get back a list of the differential diagnoses to consider based on that reasons for encounter, and this is in an XML format that can be returned to the client that's doing the query through the web-based service. We may also then want to look at particular diagnoses and look at the diagnostic cues that are in the ontology supporting that particular diagnosis. So if I go to the cues here and look at cues for urinary tract infection, for example, we get back a cue collection with each cue having an item ID and the various cues that are indicative of this particular diagnosis. So these are looking at all the general cues. We can look more specifically at patient-reported symptoms by going to the symptoms, and we get back just the symptoms. We can also look at individual clinician-observed signs, which gives, in this case for urinary tract infection, brings back urine cloudiness and urine smell. We can also then look at the risk factors related to a particular diagnosis, in this case new sexual partner, previous UTI or sexual activity, and then finally we can look at the tests associated with a particular diagnosis. So in this case we might want to run a dipstick urinalysis or pregnancy test which may indicate the presence of this particular diagnosis. So that's working from a top-down perspective, looking at reasons for encounter and differential diagnosis. We can also work from a symptom upwards, so we can look at cue differentials relating to a particular symptom. So in this case, if I look at dysuria, for example, we can see that pyelonephritis and urinary tract infection are associated with it. Or if I look at fever, for example, we get a different list of differential diagnoses to consider working from a symptom upwards. We also might want to look at the quantifications that are transferred through the data mining tool that were calculated. So let's look at the quantifications relating to urinary frequency, for example. So this brings us back a quantification collection. So in this case there's just one quantification relating to the reason for encounter urinary tract infection or urinary frequency. So this is the quantification ID. So this indicates that urinary frequency in conjunction with abdominal pain is associated with this diagnosis, urinary tract infection. We then have all our quality measures that we calculated from the data mining tool, and then we have the context in terms of the country and the sex. So these have come directly from the rule that we transferred into the clinical evidence ontology and populated. The last thing that we might want to look at then are clinical prediction rules that we've captured in the ontology. So by going into the CPRs, we can get a list of any literature-based clinical prediction rules that we've entered into the ontology, and then we can see a list here. For example, we've one here called the Alvarado score related to appendicitis. So let's have a look at that. And this will give us back a collection of the various cues and score interpretations. So for example, in the Alvarado score we have a cue element of migration of pain, and if that's present, is true, it has a score interpretation of 1, and we've got a number of other cues associated with this rule that indicate a possible diagnosis of appendicitis. We can also then look at the scoring scheme associated with a particular rule. So in this case, scoring interpretation for the Alvarado score is a score between 1 and 4 represents a discharge, a score between 5 and 6 represents observation or admission, and between 7 and 10 represents surgery. So that concludes looking at the evidence web-based service. So to conclude the demo, this web-based service will be consumed by a client. In our case, it'll be the decision support tool that's being developed. But just for the purposes of this demo here, we've just put a dummy client together to show you some calls to the evidence service and displaying our content in a client. So in this case, we can see our reasons for encounter. If I choose a particular reason for encounter, we can get our list of differentials to consider, and then I can show the various underlying signs, symptoms, cues, CPRs, risks and tests. So these are just some simple queries calling our web-based service, and that concludes our demo of Work Package 4. Thank you for your attention.